Prevention of needle stick injuries using a one-unit needleless device, the CLAVEConnector. Antibiotics, life-saving drugs, and blood products are presently administered intravenously through heparin lock and piggyback connections. In these connections, an unprotected needle enters the port, and the connection is then weakly secured with unsterile tape. Unsterile tape comes in direct contact with the needle and causes life-threatening infections. Tape does not provide a secure connection. Disconnection of the system can lead to further contamination. When the needle is contaminated with blood or body fluids, accidental needle sticks, even superficial ones, can result in lethal infections such as AIDS and hepatitis, which can occur during handling and disposing of needles. IV connections made with mechanical valves are not swabbable. These valves can remain stuck in an open position, causing bleedouts in a peripheral IV line or air embolism in a central line. More recently, IV connections have been made by using a plastic needle, which is partially covered by a plastic housing. This system, however, requires an exposed blunt plastic needle to access pre-slit silicone ports, and also requires connection and use of multiple components. This system has been reported to be cumbersome and frustrating to use, and may still become contaminated. Also, plastic needles can break through the skin or puncture underlying tissues of healthcare professionals, especially when they're administering medication to an uncooperative patient. Because of these potential hazards, plastic needle products should be disposed in a biohazardous sharps container. We have found that a newly developed IV device, the CLAVEConnector, solves the problem of needle sticks, accidental disconnections, and contamination of these systems without the use of plastic or metal needles, and also without the use of mechanical valves. Unlike any other IV system, the CLAVEConnector is only one piece whose female lure locks universally to any male lure of a syringe or an IV line. This connector has a unique plastic conduit which is well recessed and completely enclosed by a silicone seal, allowing the system to be closed, swabbable, and maintain its sterility. Once connected, the silicone seal is depressed by the male lure connection, below the openings of the plastic conduit, permitting fluid to flow through these openings. Once disconnected, the silicone seal springs back well above the level of the plastic conduit, resealing it and stopping fluid flow. The CLAVEConnector has negligible dead space, which is very important to pediatric, fluid-restricted, and oncology patients. The CLAVEConnector provides an ample flow rate without the use of plastic or metal needles. Importantly, it has a luminescent collar that glows in the dark for easier access during night hours. Without the use of mechanical valves, one can lure lock a syringe to the male lure of a CLAVEConnector and draw blood from an arterial line for arterial blood gas sampling, and from a central venous line for venous blood examination. Without the use of needles, one swabs the female lure of the CLAVEConnector with a 70% isopropyl alcohol swab, and then draws blood directly into blood collection tubes by using a Vacutainer multiple sample lure adapter assembly lure slip to a CLAVEConnector. Also, one can draw medications from a vial adapted with a plastic spike CLAVEConnector combination, and save wasting of expensive drugs because the CLAVEConnector has negligible dead space. Since it is only one unit, The clave connector is easier and cheaper to use and to dispose than plastic needles or mechanical valve systems. The clave connector was invented by Dr. George Lopez, a leading critical care specialist, after a colleague died of fulminant hepatitis. The clave connector is manufactured by ICU Medical, Irvine, California. The clave connector in-service video. Using aseptic technique, open the package containing the clave connector extension set. Next, swab the female lure of the clave connector with a 70% isopropyl alcohol swab. Proceed to prime set by lure locking a sterile syringe previously filled with sterile saline solution into the female lure of the clave connector. Invert set to fill it with sterile saline and expel air. Once the set has been primed, one holds the clave connector with one hand, and by counterclockwise rotation, disconnects the male lure of the syringe with the other hand. Remove cap on the male lure of the clave connector extension set and lure lock this end to the IV catheter. Once ready to administer medication, IV fluids or blood products, again by aseptic technique, remove cap from male lure of any IV tubing set or syringe, swab female lure of clave connector with a 70% isopropyl alcohol swab, and follow same procedure for connection and disconnection of clave connector as previously described above for priming clave connector extension set. Please, never use a needle to access the clave connector. Further instructions on the use of the clave connector. Number 1. Please, remember to gently lure lock a syringe or IV tubing to the clave connector. Number 2. After administering any drug, always flush the clave connector with 2 to 3 cc's of normal saline or other appropriate flushing IV solution. Number 3. Remember, never use a needle to access a clave connector. Whenever administering pre-filled emergency unit doses with built-in needles, please access these drugs into regular side ports at Y sites. Number 4. Sterile plastic caps on the male lure end of the clave connector and on the male lure end of syringes may be used to cap off IV tubing. Number 5. When drawing blood using a clave connector lure slip to a multiple sample lure adapter vacutainer assembly, hold the clave connector with one hand, and with the other hand, twist this assembly clockwise to both engage and disengage the clave connector. This procedure prevents accidental disassembly of the lure adapter from the vacutainer housing.